Australia regards access to primary healthcare in rural and regional areas. So I'm interested in what initiatives we have going forward in relation to providing primary health care to those that reside in rural and regional areas, and in particular around any initiatives on telehealth.
Senator, so we primarily fund primary care services at a Commonwealth level through Medicare. So there will be increasing investment in Medicare over the forward estimates. Recent budget data has just been released outlining what they will be. I don't know that I've got the South Australian breakdown of that, but there's certainly a component for services in South Australia. Telehealth under Medicare is now permanent, ongoing. We've had more than 100 million telehealth services provided across Australia since the widespread COVID items were introduced in March 2020, with Medicare benefits of over $5 billion paid for those. So it's something that's being used on a much wider scale than previously. We had small amounts of telehealth services under Medicare prior to the pandemic, but it's given us the opportunity to roll that out on a significant scale, particularly in primary care, where we've got mostly non-referred services and patients able to see their doctors, which has benefits not just for people that might be in quarantine or sick and worried about spreading COVID or other illnesses, but it's also benefiting those communities who may not have had as easy access to a doctor. So we've got quite a few models that we are trialling at the moment, in particular communities at this stage in New South Wales about using telehealth to provide additional extended services. So primary care providers travelling around communities, and we'll have some times where they're available to a sub-region face-to-face, and then the next week they'll be able to see patients via telehealth as well, so they sort of rotate between face-to-face services and telehealth services. So we have also been talking with the South Australian Health Department about what models of care we can trial in South Australia, and looking at flexible employment models where we have doctors who may be employed by South Australian Health or one of the local health districts. They're also then able to provide Medicare services. So we've been having active discussions along those lines with people in South Australia.
So when am I going to see a realisation of those discussions in my own state?
So hopefully soon. It's been something we've been working on for a few months with I think it's the Riverland, Mallee area around Berry.
I mean, each state is different. Obviously, New South Wales,
Yes.
Victoria have a greater population in their regional and rural areas. So is it, if I understand what you've been saying, the model may vary from state to state. Is that my understanding correct?
Yes, so we've got the general service provision models that are available under Medicare to anybody, but we have to recognise that if you don't actually have a doctor in place, it's very hard to provide Medicare funded services. So most of the work we're doing is targeted at solutions that work for local communities and are developed in partnership with local communities and address particular local factors to try and help them recruit, retain services of a GP in the location, if at all possible, but looking at other models where we might be able to share GPs across regions. In South Australia, we've also been looking at the possibility of the remote vocational training scheme supporting an additional GP registrar around, I think, the Streaky Bay area, which is quite remote.
Yes.
And we're continuing to look for support under the RVTS.
Are there any innovations on the horizon outside the models that we should be keeping our eye on, either technologically or other arrangements that might be possible to be put into place?
We're always interested in trialling new and innovative models, and there is a funding pool available to invest in locally developed innovative models. So it won't all be the sort of same types of things we're trialling in New South Wales. There might be things that are going to work better for the South Australian rural communities. And obviously we need to work with South Australian Health about what's going to best fit with their rural hospital services in future too.
Could you take on notice that I'm interested in the data and the take-up of telehealth in rural and regional areas in South Australia? Because obviously when you travel around, it's a subject of much debate about access to health services, and in addition, obviously, to education. So
Certainly.
I'm interested in the degree at which that the take-up has occurred, and from your perspective, the success in delivering a service, because telehealth is obviously has its limitations.
So we actually have officers from Outcome 2 who'll be here on Wednesday next week, and we can certainly have them prepared to
Yes.
provide that data to you.
And where does this exploration of models fit into the government's 10-year primary health plan? Is it?
Yes, we've had, I think, 2 separate budget measures investing in flexible models under the Stronger Rural Health Strategy. I think it was either budget or MyEFO last year and the year before.
Chair, that's...
Sorry?
I'm happy.
If I could just assist with one more thing to respond to the Senator's question. It's Simon Cottrell, First Assistant Secretary, Primary Care Division. In South Australia, for the first time under the MBS Section 19.2 arrangements, in December, 3 sites were approved where rural hospitals, doctors working in rural hospitals can also charge the MBS, and those sites are in Ceduna, Lameroo and Wallaroo. So there's some progress there.
Has there been, that's just prompted another question. Has there been any other exploration of models in relation to our Indigenous communities, which are very remote in the north of the state, obviously, and to the west? Are we exploring any particular health models there?
Can I take that on notice from our... we have an Indigenous Health Division, and I need to just check with them.
I appreciate the division. I'm just in the context of telehealth and other innovative models.
Sorry, Senator. Tanya Rishnu, Primary and Community Care. You'll be aware, particularly with Aboriginal community-controlled health services, they actually have quite a different model of funding and approach. They can access MBS items, but they have a more flexible block funding model that we fund them for the provision of primary care. We work with them regularly. We'll take on notice specifically South Australia,
Thank you.
but they are already quite an innovative model of healthcare.
Yes. And where I was going was they do have some innovations, and the interplay between those innovations and what's working there and other very remote communities. And I'll leave it there.
All right, thank you.
If you could take that on notice, I appreciate it.
All right.